Hello class, my name is Harut Karoyan and I will be presenting on lung nocardiosis for Biology 33 medical terminology. Now for some medical terminology on the subject lung, or also known as pulmonary nocardiosis. It is an infection of the lung with the bacteria Nocardia astroides. Now this is a species of nocardia that causes an infection by a bacterium. Now, before we get into the actual bacterium and the disease and what it can cause and all that, I want to go over the function and the anatomy of the lungs because that is the main organ that this disease does affect. So I want to give you a brief rundown, and it will be a refresher to most of you. Now, the lungs are a pair of spongy air-filled organs. They're on our thoracic cavity, on our chest. One is our right, one is our left. Now, when we breathe air, it flows through our nose, through our mouth, through our throat, through the voice box. The trachea, which is the windpipe, takes them down into the two large airways, the left and the right bronchial tubes. Now, these tubes get smaller and smaller. Air continues into these small airways, and when it finally reaches the end, which is the alveoli, um, it is then exchanged and it goes from oxygen into the bloodstream, and carbon monoxide is exhaled as the product of the metabolism, as the waste product. Uh, in short, without our lungs and the respiratory system, it is going to be very difficult for us to survive because that is our main breathing tool. So now to go over some of the symptoms that lung nocardiosis can cause. Number one, chest pain. Number two, coughing, sweating. A lot of these are related to the actual breathing function, and that's really what it affects. But however, you do have some different ones in there. Chills, feeling weak, lack of appetite, that's usually associated with being sick in general, unexplained weight loss. Now, a lot of these are very general symptoms. Shortness of breath or a hard time breathing is directly linked to this as well. But just a side note, the symptoms are very similar to pneumonia and tuberculosis. In some reports, people going in feeling the same symptoms, they would usually go for pneumonia, tuberculosis. Those are the first assumptions. So you have to get some deeper diagnostics on this and see possibly a biopsy, whether it's the lung, brain, or other parts it is affected. And I'll go over more of those on the next couple of slides. Now, some of the causes of pulmonary nocardiosis, really how one would get this. It is a bacteria, so it can be found really anywhere, mainly in soil, in the air. Bacteria can travel, so you can get it that way through breathing, of course. Now, it's not really limited to any region in the world. It's been reported as cases worldwide in the U.S., Asia, Europe, Africa. Really, anywhere is prone to getting this. Now, it can go through breathing. Also, if you have an open wound, it can make its way into the bloodstream. Now, on a side note, if it's not treated, nocardia can also spread through the lung, go through the bloodstream. The biggest ones we've seen are to the brain and also to the kidneys and intestines. Now, on the brain, some of the symptoms here are bad headaches, motor skill problems from anywhere from balancing, vision problems, hand-eye coordination, and you have extreme sensitivity to light and sound. So it can get very serious if it's not treated, and it does go to the brain. It can actually be more serious than lung nocardiosis. Now, some of those more likely to get lung nocardiosis, long-term chronic lung disease patients, cancer, HIV/AIDS, and long-term use of steroids. Really, anything that does weaken your immune system over time puts you more at risk for something like this. Now, some statistics for you to look over. It's a very rare disease. Only 500 to 1,000 new cases each year. Usually affects males more than it does females. And some reports, I actually found a few reports that show that Males are 3 times as more likely to be tested positive for lung nocardiosis than females. So that's an interesting find we have here. Now, some treatment and cure options. The most popular one, the one actually that's been working the best, is the antibiotics, typically from 6 months to a year. In some cases shorter, some cases longer. It really depends on how long the bacterium has affected the patient. Some surgery also may need to be done to drain the pus that has been collected on the skin or the tissues around the lung, brain, or of course skin. Biopsies also are needed to verify the severity. There are still more research and treatments being done, so hopefully something gets done and something more effective can be implemented. And there is hope. Don't ever lose hope.